Lagos State Commissioner for Health, Akin Abayomi, said on Friday that many people who tested positive to COVID-19 were running from being taken to isolation centers for treatment. Mr. Abayomi said this was one of the reasons the state still has unoccupied beds at the isolation centers despite recording more cases than its bed capacity. He spoke at the state secretariat on Friday when responding to the question on the discrepancy between the occupancy of the isolation centers and the number of active cases in the state. There is also a situation, according to what he said, that we experience. When we test people, sometimes they find it difficult to find them. The ambulance will go into community, people will flee their homes and they make it difficult for us to find them. Speaking on the stress health workers undergo, Mr. Bayomi said some positive patients sometimes shut their doors or they leave their environments to avoid being admitted. He added that the patients do not answer their phones as well. The commissioner said this is because people are afraid of coming to the isolation center and the ministry has no time to start hunting people around the community. If you have tested positive, we expect you to cooperate with us and make yourself available so that you can be admitted and assessed. Our isolation facilities are more comfortable. It is not like Ebola days. We have made a lot of improvements. Members of the executive and senior people in government have been admitted into those facilities. If I tested positive, I will go to those facilities, Mr. Abayomi said. The commissioner said Lagos residents have nothing to be afraid of as the staff are very professional. Very professional indeed. He said the state still has about 307 unoccupied beds out of the 569 total bed space available in the state because most patients are yet to be admitted, while most are on the run after testing positive for COVID-19. Mr. Bayomi said the state has 569 bed capacity and 45% overall occupancy, while 307 bed spaces are available. As of Friday, Lagos has 1,037 active cases of COVID-19. He said, we have just opened Bagada Hospital and we are yet to admit into Bagada. As soon as we fill Bagada up, our occupancy will increase to over 70 to 80%. So guys, do you see or can you hear what this man is saying? You know, the first one I really want to pick from what he said is that even senior people in government that they are even admitted in that place because the place is comfortable, is more okay compared to Ebola days. And the reason is that another thing is that these people, when they are being tested, do you just leave them? I think as soon as you know that people are tested positive, I think maybe the next thing is for you to just transfer them. You will allow them to go back and you will not be calling them to come back, because according to what he said, if they are being tested and later you say you cannot be hunting for them or looking for them around, when you call their phone numbers, they will not pick. As I don't know, okay, whether they will leave their sample, they give their sample and they will go back, maybe on that note, because the test results will not come immediately. So the reason why people are really afraid is that I believe that they have not gotten enough education, and more so, government, you guys will say something and you do something different. A typical example was what happened during Abakari, that this man could not even say the simple truth. Of course, he has been trying with the Lagos state governor. They've been trying, but at some point, it's like with that singular act, it's like they try, people just lost a little respect for them, and that's why you cannot trust the government. It's telling us that a lot of people, highly placed people, they are always admitted in that facilities because the facility is very, very good. Of course, people will run because they might we know a lot of things there, because people know that the government is not to be trusted. Government is not to be trusted, and the one thing is that they want the masses to be law abiding, but they themselves, they are not law abiding. They flout every other at any given time, and you expect people who you are leading to follow. Of course, they will follow your example. Abakari was in Lagos. He could not stay in that facility if that is what you are telling us. And we know the situation of the Prime Minister in the UK. He was in the facility that the public people are using. But in this our country, no, they are too big. They are bigger than life. They are larger than life. They will make laws. They will expect the people, the ordinary people, to abide. But when it comes to them, they are bigger than the law. So, but that being said, so if this number of people who have been tested and they are in the society, and you expect this thing not to spread, it's going to be disastrous. If the way we know that this coronavirus, the way it operates, or the symptoms, or the way it weighs people down, definitely there's fire on the mountain. But with all the things that the man has said, I don't think people want to believe them, because that singular heart, when during the Abakiri's time, people have really lost hope, and we see all the government officials who are flouting order here and there. While they are flouting order here and there, they just use some people as scapegoats. It's unfortunate. So how are they going to trace these people? Like he said, they are not even interested, or they don't even have that time to start tracing people from pillar to post, or pursuing people from a pillar to post. Someone says here that I sympathize with you, Mr. Commissioner, but why must you say beds are empty for people to occupy? Allocate the beds to members of your family. If it were to be employment, family and friends first. Someone says here that again, that he does not have that coronavirus. He that has corona can still walk around and still run. Why in the United States they can't breathe? Do we have African and white man corona? Simple question. How many of us will allow these people to carry out tests on us because we know they are not genuine? Well, it should be more than 14 days now since the first batch of missing positive cases. Mr. Health Commissioner, how far about reported COVID-19 deaths on Lagos State? Is it same as the death reports coming from the north? Now, wow. It's a simple question that the Commissioner for Health needs to answer. Someone says this country is very, very funny. Let's watch and see when people start dying like chicken everywhere. Then Nigeria can now believe there is coronavirus in the country. Game of politics. Maybe people are afraid of Chinese doctors who may visit them one day to execute their guinea pigs plans. Insincerity of federal government cost everything. Don't mind them. It's their family that will occupy the beds. I have been suspecting equipment that NCDC is using to test people for COVID-19, because even people with HIV, typhoid, acute headache, high blood pressure, etc., the equipment turns it into COVID-19. It must be Abamid, or NCDC is playing games. Maybe they are running away because of the poor feeding and poor facility in the isolation center. Someone say you tested positive people and you said you can't find them, you can't trace them. Fear God. Just listen to yourself, Mr. Commissioner. See what you are saying. If we have a lot of people on the run, then we should be recording deaths in Lagos like Kano. Now, according to the science of a coronavirus, if symptoms are well managed within 14 days, the person dies. Okay. I will advise you to resign because you are not fit to do that job. You are just saying what we don't understand. Look at what is coming out of your mouth. That is what somebody is advising the Commissioner for Health to do. These people are scam, Joe. You people don't take care of them. Another person says that they will definitely run because they know that you people are testing wrong results. If the number of the cases in Lagos is 1,600, for instance, so we don't have a 400, so we don't have and 400 have been discharged, for instance, too, and we have a 567 bed space, which means you people are looking for 1,000 persons. Abi, chai, they don't finish this country with lies. You see that people are not really having that trust in government again, because they say one thing and they do another thing. They make law, but is not, they are above the law. Nigeria is a zoo country. Everything is politics. Biafra all the way. Drop millions. Let's do the findings. The system is now being tested. I fear for Lagosians. And you say you have no time to look for them. A professor of health, you are a shame to this very profession you are professing. And someone says here that you are the problem of this country. I used to say it that there are some people who are infected with coronavirus, but they won't go to isolation center. They will just keep themselves inside. That's what somebody is saying here. This one says, okay, when did you say it? When did you say it? And how did you know they have a COVID-19? So guys, in a nutshell, what the Commissioner for Health in Lagos is telling us that a lot of people who have been tested, they are on the run. They don't take their course. They've even left the environment because of fear. But I think that you guys need to educate them the more, not coming on the news pages of newspaper and be telling them, oh, this place is more comfortable, it's convenient, it's this and that. You have to educate them so that they will know it. If we are to go by what he's saying, that means the whole place is almost finished now, because if you have many people who are tested positive to this COVID-19 and they are in the midst of people, that means they are just going to be sharing it. So it's really, really unfortunate. So guys, let's hear your opinion, because some people have said what they feel and they are not really happy with the statement of the Commissioner for Health. Leave your comments below and let's have your take.